Bismillahirrahmanirrahim. My name is Anam Arman and I'm gonna present about the antihyperlipidemic drugs. So, these are the drugs that provide the effective treatment for hyperlipidemia, that is the increased lipid level in the blood. Instructions for use. The antihyperlipidemic agents promote the reductions of lipid level in the blood. Some antihyperlipidemic agents aim to lower the level of low density lipoproteins, that is LDL cholesterol. Some reduce the triglyceride levels and some help to raise the high density lipoprotein cholesterols. By reducing the LDL cholesterol, they can prevent both the primary and the secondary symptoms of coronary heart diseases. In this diagram, the cholesterol come from the liver and the cholesterols from the dietary products, that is come from the meat and the milk and eggs, etc. Today we discuss about the two main drugs of antihyperlipidemic drugs, that is cholesterol absorption inhibitor and HMG coenzyme A reductase. In cholesterol absorption inhibitors, we will discuss about the ezetimibe and HMG coenzyme A reductase. We will talk about the statins. So, ezetimibe is the drug that is used to treat the high blood cholesterols and certain lipid abnormalities. The therapeutic uses of ezetimibe as a monotherapy or the combination with the HMGRI for the reduction of elevated total cholesterol. The ezetimibe inhibits the absorption of cholesterol from the small intestine and decreases the amount of cholesterol normally available to the liver cells. The structure formula of ezetimibe contains the carbon 24H21F2NO3. These drugs also available by the name of Zetia, Ezetrol and others. They are called their trade names. The pharmacokinetics and the half-life of ezetimibe. Ezetimibe is absorbed in the small intestine, reaching the peak plasma concentration in 4 to 12 hours with a plasma half-life of 22 hours. Simvastatin, ingested as a prodrug, is hydrolyzed in the liver, so its active beta hydroxide metabolite reaching peak plasma concentration in 2 to 4 hours with a plasma half-life of approximately 5 hours. The contraindications of the ezetimibe. The two main contraindications to taking ezetimibe are previous allergic reactions to it, including the symptoms of rash, angioedema, and anaphylaxis, and severe liver diseases, especially when taken with a statin. The antihyperlipidemic drugs, in which we will discuss HMG coenzyme A reductase. The following are the headaches we are discussing in upcoming slides. The examples and half-lives, the side effects of the drug, the mechanism, the derivatives of each drug. Antihyperlipidemic drugs, as we already studied, they are used to maintain the total triglyceride level or low density lipoproteins or cholesterol to the optimum level. It is also used to lowering the serum lipid concentration, has been shown to prevent the sequelae of the atherosclerosis and decrease the mortality in patients with a history of cardiovascular diseases and hyperlipidemia. It inhibits the formation of biosynthesis, reabsorption, or increases the elimination of the lipid from our body. It is also known as hypolipidemic drugs. These risk factors contain smoking, drinking alcohol, hypertension, diabetes, and obesity. The HMG coenzyme A reductase 3-hydroxy 3-methyl-gutyrallyl. These drugs inhibit the biosynthesis of cholesterol level in the blood. It reduces the illness and mortality in those who are hydroxymethyl-gutyrallyl and coenzyme A, also known as the statins, are used adjunctively to diet and exercise to treat the hypercholesterolemia by lowering total cholesterol, low-density lipoprotein cholesterol, and triglycerides concentration while increasing the high-density lipoproteins. It blocks an enzyme needed by the body to make cholesterol. The following are the drugs of statins: atorvastatin, lovastatin, paravastatin, simvastatin. Atorvastatin is also known as Lipitor. The dose that have to be taken in mg is 10, 20, 40 and 80 mg. The half-life of atorvastatin is 14 hours. Lovastatin, it is also available as altopref. The dose that have to be taken in milligram is 20 and 40 mg. The half-life of lovastatin is 2 to 5 hours. Paravastatin, it is also known as paravacol. The drug that have to be taken in milligram is 20, 40 and 60 mg, and the half-life of paravastatin is 1.8 hours. Simvastatin is also known as Zocor, and the dose is 5, 10, 40 and 80 mg, and the half-life of simvastatin is 2 hours. The short summary to understand this mechanism of statins: it slows down the synthesis of cholesterols, it triggers the DNA then messenger RNA, it increases the synthesis of low density lipoprotein receptor, it increases the binding of low density lipoproteins with receptor, it increases the clearance of low density lipoprotein, and it decreases the low density lipoproteins and very low density lipoproteins. The derivatives of drugs of the statins: the fungal drugs, the synthetic drugs, the prodrugs. The fungal drugs contain the lovastatin and paravastatin. The synthetic drugs contain the fluvastatin and atorvastatin, and the prodrugs contain the lovastatin and simvastatin. Those drugs which hydrolyze in the liver to form their active forms are known as prodrugs.